I come from a family who's been involved in raising funds for hospices and hospitals around the country. This new initiative is very important for Norfolk as a county. It combines the resources and the initiative from the public sector and the private sector together. It means that we can push the boundaries. I also feel that this is something that can make a difference to every single family in this county.
One of the wonderful things about hospices is the way in which families and loved ones are included in the care of the patients. They share the care, and nurses and other professionals are wonderful at helping those families accept the possible death of a patient, of ministering to them, of caring for them. So families and friends become great supporters of hospices because of their experience of them. The way we care for those who've got life-threatening illnesses or are dying reveals how we care truly for the living. And one of the great qualities of hospices is the lightness, the welcome, the spirit of them. And that's very important in providing really good end-of-life care to people.
A wide variety of people come to Priscilla Bacon Lodge for care. What they have in common is that they have an advanced progressive disease that isn't curable. Physical symptoms are a huge problem and we need to get on top of those for people. But emotional ones too, a fear of the unknown, fear of dying, but also fear of how others will cope around them. They often don't know how to talk about it with their loved ones, and we can help them through that and plan that. And then it's about thinking not only about how they would like their death to be, so where they would like to be, but it's also about living now and how they live with dying and how they can enjoy their life now.
Death is normal and it's inevitable. It therefore affects every single one of us. We are unlike other counties. We don't have a significant amount of independent funding coming to sit alongside our NHS funding. The last year that we've got figures for, over 10,500 people died in Norfolk and Waveney. And just over 7,000 of those are predicted to have needed some form of palliative care and support. We know we're absolutely not meeting that kind of level of need. We know from the statistics nationally that we have many less inpatient beds available in specialist palliative care than most places in the country should have. We've got less specialist consultants and we have less community palliative care nurses than we should have. So our aspiration is to make sure that we've got the right kind of resources, to have independent funding to sit alongside the NHS funding, establishing for us the ability to have a new building, to have extended services, meet the needs of many, many more people. That inevitability of death for all of us will be the kind of ending that they and their families really want to experience.